Hi, my name's Dr. David Olive. I'm a reproductive endocrinologist in private practice at the Wisconsin Fertility Institute here in Middleton. I'm the president and CEO of the organization. And just to show you that I'm not a fringe physician, I was in academic medicine for over 25 years. I was the director of reproductive endocrinology at Yale University. I was also the co-chair, vice chair of University of Wisconsin Department of OBGYN for a number of years. And my area of expertise is evidence-based medicine, that is using science effectively to treat medical problems. And what I want to discuss today is the issue of medicinal cannabinoids in three ways. First, I want to discuss the data and the evidence surrounding its use. Secondly, I want to discuss anecdotal experience with my patients who suffer from chronic pelvic pain. And thirdly, I want to talk a little bit about my own experience with cancer and chemotherapy. First, the facts. Cannabis and its related compounds are currently classified as Schedule I drugs by the DEA. If you're not familiar with the DEA's classification, it has Schedules 1 through 5, 1 being the most dangerous, 5 being stuff that's totally unregulated over the counter. Right now, cannabis is classified as Schedule I along with heroin. By contrast, cocaine and methamphetamines are Schedule II. That is, a doctor can prescribe them. They can't prescribe Category 1 drugs. Valium is Schedule III. Codeine-containing analgesics are Schedule V, the most lenient classification. Why was cannabis classified as Schedule I? Well, if you look back through history, the reasoning for the original classification was that it was a drug with a high potential for abuse. It has no currently accepted medical use, and there's a lack of accepted safety when used under medical supervision. That was the reasoning that was used. Today, none of those arguments hold water. A look at the facts now show that cannabis is one of the most thoroughly investigated medications in history. There have been over 22,000 published articles on cannabis, more than half of them within the last 10 years. Over 200 studies have been conducted as randomized controlled trials, which is the gold standard that we use for looking at medications and their efficacy. Thus, it's been well studied. There's no question about it. As for safety, it has a remarkable safety record compared to other drugs for pain and nausea control. And the fact is, marijuana cannot produce a medical overdose. You cannot have a fatal overdose from marijuana. I'll repeat that. In a review from 1966 to 2007, looking at all the published articles, all the studies that were done, there were no fatalities, and there was no serious side effect difference between cannabis and placebo, fake pills. So in fact, this is an incredibly safe drug. That's not to say that it's harmless. Certainly there are vulnerable populations in which the drug poses a problem, such as in adolescents, pregnant women, nursing mothers, patients with a history of psychiatric illness, stroke, and heart disease. These patients are potentially vulnerable to side effects of the drug. Nevertheless, it's far safer than the drugs currently utilized for similar symptoms. It's now been shown that in states that allow the use of medical marijuana that there's a 25% lower prescription opioid mortality rate from overdose. 25%. There's a 20% decrease in the first year, 25% after 2 years, and at 5 years plus, over 33% decrease in the rate of overdose from medicinal opioids. In Wisconsin in 2014, there were 392 prescription opioid overdose deaths. Thus, about 100 Wisconsinites could be saved from prescription opioid overdose annually by legalizing this drug. Efficacy has also been well demonstrated. Patients with at least 23 diseases have been shown to benefit from cannabis use, such as patients with chronic pain, fibromyalgia, multiple sclerosis, rheumatoid arthritis, and many types of cancer, just to name a few. Furthermore, cannabis in some situations has been shown to do more than simply treat symptoms. For instance, in patients with gliomas, which is a type of brain cancer, cannabis can reduce the size of the tumor and in some cases has even eradicated the tumor. In preclinical studies, that is studies in animals and in the laboratory, the drug seems to retard cancer cell growth. It inhibits the growth of new blood vessels, which is important to cancer survival, and reduces the spread of cancer cells. Now, those are the facts about medicinal marijuana. But a large part of my medical practice involves patients with a disease called endometriosis, a disease present in about 8 to 10% of women, and it produces pelvic pain, chronic pelvic pain, in roughly 2/3 of those patients who have the disease. And one problem with the disease is that many women who have the symptoms for more than 6 months, you can then eradicate the endometriosis and it doesn't help the pain. What's happened is they've remodeled their central nervous system and they have something called neuropathic pain, which cannot be treated with hormones any longer, cannot be treated with surgery any longer. Most of these patients are prescribed opioids by their doctors, and fully 1/3 of them who come into my office are already addicted to the drug. These patients literally beg for another treatment alternative, one that's non-addictive and has fewer side effects. They usually complain of side effects such as constipation, the psychotropic effects. They don't feel very good on opioid therapy chronically, plus the fact that they're addicted. Cannabis is a reasonable alternative in that it reduces or eliminates the need for opioids in neuropathic pain control. Unfortunately, it can't be used at this time in this state. Finally, a little bit about myself. I currently have metastatic lung cancer, although I was never a smoker, and I'm undergoing chemotherapy. I suffer from constant nausea, and pain from both the cancer and the treatment are pretty intense. When I take IV chemotherapy 3 days every 2 weeks, what I require is OxyContin, which is an opioid, around the clock, every 5 hours. Even with this schedule, every once in a while I get breakthrough pain. The pain's pretty darn intense. Feels like my chest is being compressed. It moves down my arms and down both legs. And in fact, I finished the Ironman, but this is worse than any pain I suffered during the Ironman triathlon. At this point, when I have the breakthrough pain, my physician has administered some type of opioids, shorter acting opioids, to try and mitigate against the pain. But the problem is they take 30 to 45 minutes to take effect. So what I have to do is lie down on a flat floor and try not to move for 30 or 45 minutes so that I don't exacerbate the pain that already exists. Cannabis provides relief in less than 5 minutes. There's good documentation of that in the literature. Unfortunately, it's not available to me, so what I do is lie quietly and suffer needlessly. So in conclusion, cannabis is a well-studied medication. The cannabis plant contains over 100 cannabinoids, each with different properties that can and should be exploited for medical use. For example, cannabidiol, or CBD, one of the cannabinoids extracted from marijuana, has no psychogenic properties, but it's an excellent reliever of pain and inflammation. In Wisconsin, we should care enough for our citizens to allow usage of these drugs.
Hold on one sec. We all right back there? Somebody fainted.
Uh-oh. We're getting help. Gee, I hope it wasn't anything I said. So my point again is, in Wisconsin, we should care enough for our citizens to allow usage of these drugs when appropriate for medicinal purposes. I urge you and the state legislature to support these bills for my sake, for the sake of my patients, and the many Wisconsinites who can benefit and even have their lives saved due to these drugs. Thank you.